right. Hello, health heads. Welcome and thank you for checking in to this dose of the Healthcare Uprising. I'm your producer, Jeremy Carr, here with your host, Heather Pierce. So what is on our agenda for today, Heather?
Today we have actually three people. So kind of a round table, not a round table.
A panel.
A panel.
Let's call it a panel.
Three people from a really great company called Luma or Luma Health. And so we have with us actually the specific names of the people that we have. We have Angie Azevedo, who is a staff product manager. We have Hwee Min Loh, who is a senior product manager. And we have Hannah Wei, who is a staff product manager. So these are kind of the brilliant minds behind Luma. Luma, essentially, without giving away the whole thing, Luma's goal in this universe is to enable providers, doctors, healthcare systems to enable them to deliver better care, to essentially create a much more positive, meaningful, beneficial patient experience so that you are happier as a customer of healthcare, and that you have better outcomes, you get more time with your doctor, kind of all the things that we all want. Yeah. So they're just kind of the little magic elves in the background.
They're trying to lubricate the healthcare system so it moves better. That's going to tie into an analogy I make later. So without further ado, let's jump into it. Here's our conversation with, I'm just going to say the panel from Luma Health.
Hi, and welcome to the Healthcare Uprising podcast. Today we have with us a panel. We've got three folks from Luma Health, Angie, Hwee, and Hannah, and each one of them are going to get a chance to talk a little bit about what their role is, about Luma, but we're going to start with kind of the main question. Who is Luma Health, and what exactly is it that Luma does in the healthcare space that benefits consumers, patients, kind of the end users of healthcare? And so I think we're going to have Angie kick us off, and then we'll get to know the rest of the gang here. So welcome to the show. Thank you so much for joining us.
Thank you for having us. Quick intro on Luma Health. We're a health tech company focused on helping getting patients care faster and easier. We've been in the game for a little over a decade. We work with health systems and clinics to improve access mainly, everything from scheduling, referrals, patient comms, and now like AI-powered workflow automation. So we want to really get behind the scenes, prevent all that operational chaos to help patients get care.
Wonderful. Thanks for kind of laying the groundwork there a little bit.
And that's very cool.
It is.
So we're not waiting 6 months to see a specialist kind of stuff.
Exactly.
Yeah. We love that.
That's a major problem. We've covered a lot here, so this is going to be good.
It does come up quite a bit. Yeah, for sure. And I actually, too, just to be honest with everybody here, I was so glad when your PR team came to me about Luma coming on the show, because I had you guys on my radar for some time. So I am really, really quite honored that you're here on our podcast. So thank you so much for joining us. With that, Angie, so you've been with Luma the longest, just over a decade, seen it grow early stage all the way through the various funding rounds, which are actually, that terminology with funding rounds, I think is getting a little bit more common with our audience here, Series A and all of those things.
I haven't heard that one in a while, but I remember.
Yeah, the startup language. But what has changed the most internally as you've scaled and grown, and just kind of tell us how things have changed. Give us kind of your story and your experience since being with the company.
From a company perspective, I feel like the problems get bigger and more serious, but they're all underlyingly the same, like the same operational issues, trying to get products prioritized, features out there, getting people to notice us. They just get kind of bigger and more serious over time. But I think overall, like our company vision has stayed the same. It's like helping patients get care. That has not shifted in the past 11 years now. And I think what's common for us is like with our audience and with our clientele, like healthcare operations, like their staff is spread thin, and that just keeps getting thinner every year as it goes. So our problems just kind of shift with the way that the market is going, which I've seen over time. And I was employee number 5, like we were working out of a closet. We literally rented a storage closet, and now we're at like 250 employees all around the world. So it's been really fun to watch the company grow this way. But I would say the day-to-day feels relatively the same.
I love those stories. It's like, it makes me think of like Apple, right? Like it started in Steve Wozniak. Is it Wozniak? Did I say that right?
I think that's right.
In his garage, right? And then, I mean, Apple, I'm looking around the studio here and I've got Apple products everywhere. So now Luma's going to be everywhere, right?
That's
the plan.
Yep, that's the plan. So obviously you've been with the company for quite a while. You've seen it changed. Now, obviously, like internally, it still feels kind of the same. And I will say for Hannah, and I believe you might have been there the second longest, or if I'm wrong, it could be Hwee, but I'll let you guys talk to that. But externally, though, like in the industry, right? You've been in it. I'm in it, right? I've been in the healthcare industry for 24 years, and I can say, without a doubt, in the last 6 to 7 years, so like COVID time, right? Through now is probably where the industry itself has seen the most rapid change so quickly. Do you think that COVID really sparked that from your perspective?
Yeah, I mean, when I first started, I was like a customer success manager here, and I was still debating with people whether patients wanted text messages or not, which seems just crazy to imagine now. Like everyone was like, we want the human touch, that we're not ready for text messages yet, which is just absolutely insane to think about. But now through COVID, for better or for worse, it totally accelerated healthcare consumer expectations. It felt like almost overnight. Like we went from like a little company to like working all these crazy hours trying to get patients to care because they were stuck at home. And like during this time, patients got used to ordering groceries on their phone, virtual meetings. Even in my product demos, I was able to use like Amazon one-click buy as like an analogy for healthcare, and it immediately clicked, which is just unimaginable 10 years ago. But the biggest permanent shift, like I would totally agree, is like convenience to care is no longer seen as like separate from like the quality of care. It's almost all seen as the same thing. So like patients are not seeing like long hold times or confusing scheduling as like minor inconveniences anymore. Like, oh, I'm going to the doctor's office, I just have to wait 4 hours. I don't know, making that up. But they see that part of the experience of healthcare itself. And then meanwhile, like staff shortages forced healthcare systems to really rethink how they were doing all of this, like manual operational work as well. Like, could it be realistically sustained with the previous models that they had? So I feel like for sure 1 million bajillion percent, as much as I could say, it totally shifted things.
Yeah. I like to reference kind of the concept of how many of us, pulled the plug on having like direct TV cable. And then, okay, we have control over what we want to watch. I want to choose Paramount or or maybe I don't want Amazon, right? And I want Shudder because I love horror movies. I have Shudder because my husband loves horror movies. You can kind of choose, really what you want to engage with, what you need for that season of life, or maybe you have specific healthcare, chronic conditions versus like, a younger, healthier family who may not. So it's nice to see that shift happening. I mean, this is what we talk about on the Uprising all the time, is the companies like you who are changing that. So we're here for it.
That's why it's called an uprising.
That's right, because healthcare should have always been consumer focused, right? But it hasn't been, and there's a big shift happening there. So yeah, we love it. Hannah, I want to go to you next, because you have been building AI products, and AI is a huge topic everywhere in the universe.
Just everywhere.
I mean, it's everywhere. But you've been building AI products, and remind me again how long you've been with Luma.
So I've been with Luma since late January, so less than 6 months.
You're the newest member.
I am.
Okay, cool. So again, you've been building these AI products. You've been doing that for a few years, and what made you want to come into an existing company, which, still growing, obviously, young in the grand scheme of things, right? But what kind of attracted you to come to Luma, and what exactly are you doing there? So
yeah, definitely. That's a lot of questions rolled up in one.
It is. I apologize. I tend to do that.
Let me know if I miss anything. So I've been building AI products for over 10 years now, and AI intrinsically is not a new technology. Like, it's been around for a long time. It was usually in like an academic setting that you would be leveraging AI, or it'd be like really hidden behind the scenes. I think in recent years, as it's like really come to a head where people are starting to understand it, it's like really picked up speed. And I think basically with this shift, like AI hasn't really changed intrinsically, but it's really democratized like the 0 to 1. So how quickly can you put out a prototype? Which basically means like anybody can spin up an AI startup, right? Anybody can throw LLM at like a big lucrative problem area such as healthcare. You'd be like, oh yeah, we have an AI healthcare startup, which is why there's like a massive boom in how many of them are in the industry. What's different though is all of these companies intrinsically have like the same foundation, right? It's just LLMs, like it's the same as if you go to ChatGPT, if you go to like Claude, etc. What's different is if you already have that platform, that base, like what gets you to scale is having that platform of people, having the expertise, having the data yourself. And so Luma's been around for over a decade. What really drew me to it is the fact that it has over a decade of actual patient engagement data. And that's not something that LLMs can just help you with because it doesn't have access to that data. That's the data we have that's unique to Luma. And so that and the fact that Luma already has all these customers that are in love with Luma, even before AI was a thing, even before AI was cool, they've been around, and Luma's been around servicing patients first and foremost. And so I think that having that foundation of being a platform and having that historical patient engagement data is really what'll make the difference in this like big AI bubble. And so that's the big reason why I joined.
Yeah. I have a lot of conversations lately, usually associated with this show. And in fact, even the company that I work for, because I actually work for a startup and do the podcast. And what I have seen, the biggest change, and Jeremy may have noticed this trend, is that some of the best brilliant people that are changing healthcare are actually non-healthcare people. And the industry needed that big time. So
Juliette Oliver, we just had back for the second time. She was an engineer. She was like a mechanical engineer, an electrical engineer, something like that.
Yeah.
And she figured out how to put endometriosis into remission.
Yeah. A gentleman,
now she has an app that's FDA cleared that everybody can get on.
Yeah. Even a gentleman I met with this morning who's going to be coming on the show. He started again, AI, talking around that topic. He comes from an entirely different industry, supply chain management, and is applying concepts from that industry into health. In healthcare, it's like we were, no pun intended, we were dying for it, right? Because the industry, it's a behemoth, right? And it's just this.
You need a logistics guy to make it all work right.
It's so so I love that we're getting people like you guys who may have not come from traditional healthcare backgrounds that are bringing this kind of technology and this new perspective, because it's good for us, right? It's all good for us at the end. It's going to help that care delivery, the access, all of the experience, right? The end to end, the data, everything will be better for it.
The technology woven into healthcare now makes it so like you kind of need the technology people, not just the healthcare people.
Yeah.
To make it all come together and work like we want it to.
Yeah. So we're grateful for you.
Happy to be here. Thank you guys for having me in the industry, And I think the main thing that kind of like to your point a little bit earlier with healthcare, again, my whole family is in healthcare, right? So I'm not completely foreign to it. But people who end up going into healthcare, I feel like have a tendency where ever since they're young, like they have this inclination where they want to help people. Like, I want to be in healthcare. I want to help people. I want to help patients. And so this is like most of what you do with your journey towards in your education and your work experiences. So it's like you spend your whole life in this career path. And so you don't get as many opportunities outside of it. Kind of like what you said earlier, like mechanical engineering or other industries. It's not one where you guys bounce around a whole lot.
Yeah.
Right.
Yeah, that makes sense. It's like that saying, look for the helpers. Guess what? They're all in healthcare.
Yeah. Just look at the nurses, man. You can't do that job unless you want to.
Yeah.
Like it takes a certain type.
Yeah,
there's no doubt.
That is for sure. So in terms of AI, and Hannah, I want to stick with you for just a minute, and then Hwee, I'd like to jump over to you because you also lead one of the AI products there at Luma. So in terms of AI and how it shows up for, let's say, the end user, maybe the providers that are accessing or benefiting from Luma, can you maybe expand on that a little bit to share what does it do for them at the end of the day? Like, what is that? How is the experience changing for the patient in terms of the work that you're doing at Luma, whether it's AI specific or not?
Let me make sure I'm understanding your question. So, with AI coming into healthcare, you're curious about how that impacts the end patient and the providers,
Correct.
and how
Yeah.
things have changed essentially.
Mm-hmm.
I mean, honestly, I think a good AI is just like a layer of technology. It's no different than, now we service mobile, now we're on the internet, now we're a cloud-based company, right? Like I think a good AI product should be hidden behind the scenes. And kind of like what you said a little bit earlier about, Luma one day will be everywhere. Like Luma is everywhere. But the thing is, like, you want it to be hidden behind the scenes, right? Like it's supposed to service the end goal, which is that patients get seen by the provider, they get everything that they need. It's not supposed to be something that like is a really big brand that stands in your face. And so same goes with like our AI products. I think good AI is that it's quiet, it's hidden behind the scenes. You want it to be transparent, you want it to be trustworthy. So you want it to have like an audit trail. So like let's say you're the provider ultimately. You want to be able to track down and understand exactly what decisions the AI made and why I make those decisions and what exact path it took every single time. If you need to see it, but also it's hidden behind the scenes. So if you don't want to see it, if you trust it and just want to hand over the reins, that's fine too. So in that sense, ease of use for sure is supposed to help save time. So you don't have to spend your day on like the mundane everyday tasks, but you can be working on the things like actually seeing your patients, spending more time with them, spending less time on taking notes, spending less time answering calls. And I think the main thing to call out here, though, is AI in healthcare is different from just AI anywhere else because patient data is so sensitive and it's really important. And so it's very important to keep in mind that for us, the most important thing is where we have to safeguard the patient data. And so our security operations team is on that 24/7. And we always want to make sure that we're up to the highest standards of security and certification.
Yeah. Yeah. HIPAA is a big thing. Yeah. PHI, all of those terms that I use almost on a daily basis myself. So I appreciate you. And I think it's important because these are like the intangibles, right? Like as a patient, as somebody walking into an office, experiencing something just in general, right? Like moving through the care experience is the outcome for the patient. You're kind of in the background making that or enabling that, right? So in so many words, which
hopefully we're in the background. It would not be great if you're seeing us all the time. I don't think that's what AI is for.
See, the analogy that came to my mind while you were describing that was the oil in my car engine. It keeps it all moving, but you never think about it until once in a while you need an oil change, but most of the time you never see it, but it's what keeps everything moving, right? Just keeps everything moving.
That's a very good metaphor.
As the man in the room, I thought of engine oil.
Of course. You're playing the right role,
but it's a
Jeremy.
good analogy, right? Good analogy.
That's a great analogy.
I feel like I'm like, you're supposed to change your oil. That's how I'm feeling with this.
Well, not in this case.
How many miles? 3,000, 6,000?
5 to 10, depending on the vehicle you're driving.
That's right. So thank you. Yeah. Great metaphor. I love that. So we haven't heard from you yet. And so you also work on one of Luma's AI products. And so I want to talk about that work a little bit more and what you do there. So what's the challenge for you? Is it building the AI? Is it integrating into the workflows? Is it something else? And can you talk a little bit about specifically what you actually lead? Like, what is that technology without giving away the recipe, of course?
Yeah, happy to talk about it. And maybe let me just answer this in like two parts. I'll first talk about like what has been maybe more challenging between, is it like building the AI or actually integrating the workflows? I think honestly, it is more around integrating into workflows. And I think I really like how it was discussed earlier where, Luma has this 11 years of background. We really didn't start with AI and then think of healthcare afterwards. We already have the healthcare piece and we're trying to like sort of use that knowledge, use the expertise to see how AI can be beneficial. And I think this is especially important because we continue to put the patient and the provider and the healthcare staff in the center of everything that we design. And this is really important because to Hannah's point, like AI should be almost opaque to the user. It should help make everything feel easier, but at the same time, you don't need to really know what the technology that's powering, as long as it's safe, it's trustworthy, it's transparent. And then one thing I will also add is that with healthcare specifically, I think Hannah may have touched on that. There is some nuances when it comes to AI because there is always going to be some level of certainty that is required in healthcare interactions. And by the same time, you want to also give the AI that some level of agency so that it's able to be adaptive and personalized to the interaction that the user has with AI. And I think this is a good segue about the product that I'm building. So I'm currently leading a product called Navigator, which is a conversational AI agent that is patient facing. So that, when you think about that phone call that you have to make to your patients, and I'm one of those patients, I love to call, that's my preference. But I do not want to wait up to 30 minutes for someone to basically tell me if there's parking at the clinic I'm going to. Or for example, if I'm, just over the long weekend, I got stuck in a 9-hour delay in Hawaii. I want to reschedule my appointment. I don't want to have to be waiting on the phone call for 30 minutes in order to get that done. So what Navigator is able to do is, be sort of in the phone lines so that for routine questions like, parking or rescheduling an appointment, what time is my appointment tomorrow? The AI agent is able to take that information in a very PHI secure way, get the patient the information they need with almost zero wait time. And I think this is really powerful because, we see the value of, humans still manning the phone calls, but we want to make sure that for things like, these routine calls that, we don't necessarily need a human to be able to answer those, and the humans can focus on the things that are more complex around healthcare. Like, for example, if someone comes in with an adverse event or someone is asking for something that, there should be no automation around that because a human needs to be involved, that they can focus on that and allow those patients to go through much quicker than someone who's trying to, ask for parking information. Because just like any phone call, it's still a first come, first serve. If the first call is about parking and the third call is about someone who's bleeding, you have to get through all 3 calls to get to the person who's bleeding, right? But how can we get those 2 calls out of the way so that the third call, which is about a serious event, gets to a person as quickly as possible? And I think that's the power of AI to help sort of segment the calls and help to sort of distribute the workload, especially with conversational AI that, really just boomed from November 2023.
So it's a triage program for the phone system.
I was just going to say that.
How the ER does triage, depending on your problem, that's how quick you get seen. It can do the same thing for call screening. That's pretty brilliant.
Wow.
Yeah.
Mm-hmm. So is Navigator, is that a provider's choice who's working with Luma that has a contract with Luma? Can they choose to have that Navigator tool, or however you want to explain that, as part of their practice? How does that work?
Yeah, our main customers are definitely the health system, the practices, and we work with them to basically almost build up their agent team that can help them with some of the phone calls that they're handling. So those will be our main sort of customer profiles. And typically, with Luma, we do have a very personalized way with treating our customers. So we go in, we really understand their workflows, we understand their pain points, we understand what is driving a lot of the operational bottleneck that they face, and then we sort of build that solution together with them. Luma as a platform is highly configurable, and Navigator is that layer that sits on top of the platform. So there's a lot of customization and configuration that can come with it, so that when we do roll out the solution, it's something that really meets the customer's need, or in this case, the provider clinic's need, and be able to take on those calls and help their patients.
Gotcha. And Luma, just to be clear too, Luma will, it's almost like not white labeling kind of, to a degree, right? Because no one's ever going to see Luma, or at least the patient won't, right? So it's just the experience that Luma is creating, the enablement of the providers to deliver better care. So a provider or health system or health network, whatever term you want to use, they're really going to be the ones that are going to essentially partner with Luma in order to enable their practice and their care delivery to show up the way, whether that's using maybe Navigator as an add-on. Is that kind of generally how it works?
Yeah, we definitely want to leverage the trust that a patient already has with their clinic. So, like, if you think about generally, like what Angie was describing about what Luma does, if you think about your appointment reminders, you think about the ability to self schedule on a website, what you see is the brand of the clinic that you're going to. But the software that's powering all of it, to Hannah's point, is sort of not visible to the patient because we're just there
Right.
to make sort of the practice workflow operations a lot easier. And I think that's the beauty and power of Luma, that we can be everywhere, but not at the same time very visible.
Actually, and one of the things I've also heard too, I was at a conference in LA a couple weeks ago, LA County Medical Association. Basically, it was all a bunch of doctors from the LA area. And so I was listening and I was hearing that. And one of the other things too, which doesn't necessarily, it may not be something that you might ever hear, but these providers, they want to be called doctors because they have been kind of labeled providers too. And so I want to actually say that out loud is that we have to stop
So we
calling
need to
them
stop calling them providers and start calling them doctors again.
and calling them doctors because
That's fair.
I think
Also,
I think, anyway, there's a lot of stuff happening in the universe right now, for the better. And,
doctor's a way more fun term than provider.
it is. Provider's kind of boring.
I think it's broad given that providers kind of encompass that larger umbrella of who's seeing patients. So I can totally see doctors being like, call me doctor.
Yeah.
Yeah.
Yeah. And truthfully too, we've got it, you've got a lot of providers, doctors that have been, delivering care for a long time. They're, looking to retire, transition out, or like pass it on to maybe, like a son or a daughter or a family member. We've got a lot of younger doctors coming up. And so AI enabled, tech enabled work, right? And workflows like what Luma provides. I think it's expected, right? Like there's just a demand for it. So, and us as patients, like we want it to be different,
Yeah.
So,
I mean, the easier it works, the better it gets.
Yeah.
And like, that's what this is all about to me so far, is just making everything work easier.
Yeah.
Just make it all easier.
Getting it done. What do you think about, and I'm not sure which one of you would want to answer this one. It's a little bit more of a general question that I didn't have either one of you pinpointed for, but in terms of, and we've been talking about fixing the patient experience, and what do you think most people still fundamentally misunderstand about why healthcare access is so broken? And what Luma is kind of plugging into these workflows to really remedy that, right? Or at least improve what that access looks like. Do you have any thoughts on that, or either one of you want to take that?
Yeah, I can take that one. I think when speaking of a lot of customers and all of us are being patients as well, I think there is still that issue around needing the patient to know where to look. So say, for example, you have provided some automation, provided some self-service, but you need to know, like, is it behind a patient app? And then if it's behind a patient app, you have to log in or you have to download the patient app. Or for example, you might fill out a form and then realize that, oops, like the appointment that I want to schedule, I have to call. So like there's still quite a bit of like friction and roadblocks around. And I think the second point that I will also make is I think there is a fundamental difference between like making it easier versus passing the load onto the patient. And I think that is a bit of a distinction there because at the end of the day, you want to make sure that there's a balance between like making everything more exposed, in some ways easier, but at the same time making the patient fill out maybe like the same form 5 times, right? And this is something that we hear a lot from our patients and all of us as well. Like if I go to the same clinic twice or I go to the same clinic like that's at a different location, why do I have to tell you the same thing about like my family history? Like you should know that. Like why am I filling out twice? So I think those are the things for us to really think about. And I think for Luma being very patient and user-centered, that is mainly one of our core tenets. And I think, just to make a third point here, I think there's still a lot of manual work on the shoulders of staff that goes beyond what structured data is able to support. So if you think about multiple software, you think about like people who still have scribbles on a piece of paper, and I've seen that myself when I'm shadowing customers, or sometimes is information that lives in people's head, right? So there's a lot of limitations sometimes with, even the good intentions of making healthcare easier, that it's just hard to like corral all this information to create the automation that you're seeking. But I think AI provides a lot of excitement here, because AI almost helps to synthesize even unstructured data. Like you can put maybe like a PDF or put a CSV or put down some notes of what people have in their heads, and it's able to synthesize all of those fragmented information to provide an automation that I would say, historically has not been possible. So I think, I would say that it's a very long-winded way of answering your question, but I think it's a very exciting space to be in healthcare right now.
Yeah, I agree. It actually, you just made me think of, because I'm obsessed with the show The Pit. I don't know if any of you watch that. Okay.
Yes, I love it.
Okay, cool. So all right. So I'm thinking about the new in the last season, the new attending. She was implementing the note taker, and like some of the doctors which weren't using it, they're like, oh, it takes too long, or it's this or that, and there was a lot of grief over the using the AI for like for the note scribing and stuff. Anyway, as you were talking, I was thinking about that, and all the doctors that were either happy about it or were not. So, but adjustment, right? I mean, everything takes time. We got to get rid of those faxes eventually, don't we?
It's crazy. That's still a thing.
I know. In paper charts, do you see, you said you've shadowed clients. Are they still using paper charts?
Not as much paper charts, but I do shadow a lot of like call centers. And sometimes when you look at when you're transferring calls, it is literally a sheet of paper with numbers of who to redirect a call to. So I think, kudos to a lot of, the people who help, make healthcare easier for all of us as patients, but that is their day-to-day reality. And, to just go back to your example of the pit, I think even with AI, change management is still a thing. And I think even more than ever, because of how fast AI can move, change management becomes even more important to create the adoption around it as well. Like similar for a navigator, like one of the really interesting things I've seen is that when people start calling in, they are like, they have to learn a whole new way of speaking, even though the goal is that they can speak naturally. But it's just so foreign to them, like, oh, I'm speaking naturally to a bot. But eventually, once they see the potential of it, they really want more out of it. And I think this is also like why it's like really exciting to see how AI and healthcare is going to marry together and create all these new experiences that is going to feel really natural and help healthcare access overall become easier.
Yeah, that's it. That's you make a really good point about that.
We definitely see papers. Sorry,
say
I
that
asked
again?
that question. Like we definitely see paper forms still. We run into places where people say like, oh, put that in my inbox. And we think it's an electronic inbox, but it's like a physical box on their desk that they go around to collect.
Oh, wow.
And
like
so
a basket?
we still see that. Yeah. And there's no schedule. So they make rounds like 4 times an hour. They go around to check everyone's physical inboxes. So that's something we still see.
Wow.
That's so 80s.
It's and guess what? Surprise! That just reminded me of the show The Pit again. I really like talking about this show. When they had the whole system, when all the systems went down, it was like a cyber attack, and all of a sudden they had to shift from like using monitors and their iPads that they take into the into the triage rooms, and it was like mass chaos because they were back to using
we don't remember how that works anymore.
Paper systems, and it was like. Anyway, I don't want to give away too much of the show if anyone hasn't watched it. So
we have customers who spend hundreds of thousands of dollars on paper still a year just for printing things out.
That's crazy.
I'm a big pen on paper guy myself. I take all my notes on a yellow legal pad.
Yes.
I like paper. I do. But like AI, I was going to say, I feel like where AI, I think, is maybe the number one most helpful out of anything in the entire universe where AI shows up, it's in healthcare. I'm a believer in that.
Yeah, we've seen some pretty amazing applications for it on this podcast.
We really have. Yeah. And I mean, just as you're using it here at Luma, I wanted to ask another question too. And I had and Angie, again, it could be you. It could be, well, actually, Hannah, this might be a great question for you as well. We were talking a little bit about COVID, right? COVID comes up a lot on this show just because there was so much great technology and innovation that came out of, I think we were all just sitting in our homes, locked away, brilliant minds, right? Like they don't stop working.
We actually had time to think about stuff.
We did. It was, what was the,
You don't usually get that opportunity in life.
it was like a giant slowdown, right?
Yeah.
But like we kind of had to go a little inward, and we all got busy working, and, you know, like brilliant minds do not stop working. And so many great things came out of COVID. So yeah, Angie, you know, this, I was going to ask you about this, but Hannah, I'm going to go to you because I want to talk to you a little bit more. From your perspective, because you were building AI products during COVID, if I'm getting the time frames right,
That's correct.
what changed? Like, were there like light bulbs going off in your brain at that point? Were you seeing things happening as a result of COVID? We've had staffing shortages and, you know, just the overall digital transformation and everything else. I'm just kind of curious about what maybe you saw change there from your perspective.
Yeah. So like what changed during COVID? This is actually exactly what you and Angie were talking about earlier, where people's comfort level or willingness to trust technology increased like tenfold during COVID, just because we had no choice, right? So like everybody had to get on the internet. You couldn't rely on going to somebody's office, seeing them in person, right? Like whether this is in healthcare or any other industry, you can't just show up at their door to be like, hey, can I book my next week's appointment? You're like forced to do it on the internet. You're like forced to open a link. And I think that was really what accelerated. I think people's willingness to try technology is what really accelerated the growth of AI. Yeah, it's always been around, but you know, I think there was a lot more aversion to people wanting to talk to a robot, right? Like, oh no, that's very like futuristic. We're not getting into that. And so I think there was like a lot of pushback, but that era really forced us all to go onto the internet, and then forced us to get into technology.
Yeah. Yeah, I think you're right. I remember it being like Teladoc, big company. They were like the first like virtual mental health company that was on the market. Actually, a good friend of mine still works there. And that was like, wow, right? That was like 10 years ago. Oh my God, virtual telehealth, like what? And then, and I was working at Aetna at the time, and we ended up contracting with a company out of, I believe they were out of Seattle, called 98.6, and it was text messaging. Are you guys familiar with that company? Anyway, it's text messaging. You were talking about, one of you were saying this about like, oh my God, who wants to text message about their health? Now we're like, wait, give me all the text messages, right? I want everything. Like, I don't want to talk to a person. And we thought, wow, we're so ahead of the curve with this 98.6 like telehealth medicine app. And I thought, oh, I don't know if I can use it. Like, I was apprehensive about it. And now it's like, duh, like if you're not texting, like who are you?
Yeah, right. So. That's how I communicate almost exclusively in life. If you're not in person, then it's text.
Yeah,
I don't answer phone calls.
Really great for introverts.
Yeah. Even just giving your email or phone number away, you know, those, I feel like they've come such a long way since COVID.
Right. I mean, it's so crazy. And I mean, I'm just and thinking about too, to kind of bring it back to, you know, what we're talking about, which is improving, right, the care experience, the patient journey, right, from how they engage with their, you know, with their healthcare system, with their, you know, their provider or doctor, and how technology is showing up to enable that, and the things that we demand now as consumers, in that journey it's like night and day from, you know, 5, 6, how long ago was COVID? I forget.
Yesterday. Feels like yesterday.
Right? Oh my gosh. Was that 6 years ago?
Yeah.
Good grief. Where's the time gone?
5/6, basically.
Yeah. You know, it's like a before COVID and after COVID, right? BC and AC. This is how we split the time now.
5 years ago around now, everybody was getting vaccinated.
Yeah, I think you're right about that.
That's the timeline.
A lot has happened in a really short amount of time. So, and I'm sure Luma has grown exponentially during that time as well, and had to kind of evolve, right? Like anybody. So in thinking about everything we've been talking about here, and this can be for anyone who wants to take this question, looking 5 years ahead, maybe even less, honestly, because things are moving that quickly. I can tell you that
From 5 employees to 250 employees is a pretty big surge.
Working in the healthcare tech startup space, like a month, it's like life can be significantly different in 30 days. It seems like it's pivot, right? And that's kind of the beauty of startup space too, is that you're very nimble and you can test things and be like, nope, that's not working. Try it this way. But in terms of the healthcare experience, so, this show is for consumers at the end of the day. This is for all the people. And whether you're in the industry or not, right? Like, we're all patients, right? I don't care who's listening. Even if you're the CEO of a healthcare company, you're going to end up in the doctor's office one day, right? If you're not already there. But what do you hope patients never have to deal with anymore? And how is Luma helping to make that happen? And
So we chatted about this all together during our prep for this. So I think a big piece for us, there's only so much we can control as well from like our little bubble of Luma Health, as big as it may be to us and our customers, and we are everywhere. But healthcare is so big, and that laundry list of items is like a CVS receipt. I don't know if that joke is old, but it goes on forever and forever.
I don't think
forever.
So.
Yeah.
Yep.
And so a big thing for all of us is we hope that patients no longer have to play like this healthcare detective, figuring out where to go, who to call, whether something's covered or not, sitting on hold just to schedule an appointment. And so much of this burden is on patients today, and it's just really not fair. Like, you're just trying to get the care that you need to feel better or take care of yourself, be proactive. So 5 years from now, something that we hope is like the best healthcare experiences will feel much more connected and like proactive. You shouldn't have to handle your insurance yourself and like call people to get your prior auths approved. Like, it's just insanity to us. And so we see Luma playing a huge role in like helping health systems automate as much as possible, orchestrate all of that behind the scenes complexity so that patients can feel simplicity. Like, they don't need to know that we exist, but they just feel like their healthcare has gotten better. So patients spend less time navigating healthcare. And like, I think that's something our CEO says all the time, but more time actually getting the care that they need, which is totally our bread and butter here at Luma.
Yeah. I think you're right about that. That's what we all want, right? I mean, the doctors want that. The patients want that. We want more of that, to be very hip IRL time. That's in real life for any of the old folks listening and don't know what that acronym means. I have kids.
Been around a while. I know what that means. I'm old.
I have teenagers. And I think that's what, like, let's get healthcare back to where it was at one point, right? Before I think a lot of things changed, when doctors used to show up at your house. Oh my gosh, house calls.
Could you imagine?
Maybe not quite that, but there is a lot of that happening though. Actually.
I mean, that's kind of what telehealth becomes in the end if we do it right though, right?
Yeah.
It's like a house call that they don't have to actually physically be at.
I love telehealth. I think that's great. And I think that's what we all want. But in terms of AI, and so maybe, Hwee, or maybe for you, Hannah, maybe both of you, since you're kind of our AI experts here, what do you think AI will, or do you think AI will make healthcare feel more human or less human? Where's the balance there? Like, what's your take on that? And both of you feel free to answer if one of you wants to go first. Or
I think from my perspective, AI would make it feel more like working with humans is sort of my take. I think this is definitely going to be a hot and spicy topic about like whether AI would become a human. Like, I think AI is helpful in the way that when it can start doing the things that is able to help like ease a lot of our burden. I think Angie talked a lot about like how to be where the patient is at. But I think, from a staff or a doctor or a provider perspective, it's also simplifying a lot of what they have to juggle with on a day-to-day basis. So the way I see AI is being able to provide outputs that meets the quality of what a human needs versus being more human. So for example, instead of having to switch between 5 different softwares or call someone because it's tribal knowledge in that person's brain, like all of that information can live in one place, and that I'm able to just like say, hey, I need to look for information about this patient, or I need to understand the new regulations about this to help my patient who's right in front of me, is able to then tap into that and provide that human quality output that assists the human in doing the job they want. So I'm not sure if I'm exactly answering your question, but that is how I see AI being able to work with humans than to be more like us, if that's my take.
Nope, that's great. That's a perfect answer. That's a great answer. Hannah, do you want to answer that too? Do you have kind of a perspective you want to share?
I think that's a perfect answer. I agree with Hwee Min. I think that, ultimately it's to power up the humans. And so your human interactions will just be more efficient, be more valuable. Like there's more you can get out of it, right? Like even the doctors behind the scenes have to Google sometimes because they're not remembering all 30 years of their experiences in their heads. But, if they can tap into that real quick, like when they're talking to face, that you get so much more out of that as a patient than if they're like, okay, let's talk for 2 minutes and then I'll get back to you later through the portal.
Yeah.
Right.
And, I think us as humans, right? Human connection has become more and more important as, ironically, right? As more tech enabled we've gotten in this world, that we kind of sit in our rooms or our houses and we don't have to leave. Remote work for that matter, right? That's become more common. But to me, like healthcare, it's most of the time, and like I just said, I love a virtual health appointment, but there's something about that in-person time that you get with your doctor, right? And for it to be meaningful. I feel like that will never go away. So
being in the same room matters on a certain level,
Yeah.
That's why we record this way. Me and Heather, we've done 2 episodes ever that we weren't in the same room, and it felt weird.
It did. Yeah. But yeah, and I think that's to me, that's kind of the underlying message here is that at the end of the day, the healthcare system, one, needs companies like yours to enable a better healthcare experience for us, because that's what we want. We want to be better taken care of. We want somebody to listen to us. We want more time with our doctor, like we do, because, and you don't want to spend, 10 minutes going through the phone tree trying to figure out what time, the parking. I think somebody mentioned that.
That's where we started. Yeah.
Yeah. I was having flashbacks to a moment where that was me going through. I was just like, oh my God, I just need to know what time it's open. Like, why am I going through? This is a waste of my time. So, so I think, having that better experience, it's good for everybody. Right. And then doctors get better reviews.
And doctors and patients, like it just makes it easier for everybody too. Like you're aiming it toward the patient and making it better for the patients, but it's obviously making just kind of the whole thing. I'm back on that engine oil analogy again in my brain.
Yeah.
Just makes everything flow.
Yeah.
Makes it move smooth.
I love it. I think that's a good metaphor. I think that's a good note to end on too. This has been a great conversation. Thank you all for coming on. I hope that everyone listening understands it's like you're like the elves up in the North Pole.
Yeah, there you go.
Working behind the scenes, making sure that Christmas goes off without a hitch, which is, look at me with another metaphor.
Your analogy was better than mine.
Okay. It might be. But to all of you, really, I'm really, really happy that we found each other and that you came on the Uprising to share your story and the good work that you're doing behind the scenes, so that on the other side, all of the patients of the world are having the most positive patient experience and outcomes possible. So, so there you go. So they're doing the good work.
Thanks so much for having us. Thank you.
Yeah, thanks for having us.
Thanks for joining us on the Healthcare Uprising. Make sure to hit those like and subscribe buttons before you go, and take a moment to think of a friend and hit that share button. You can find us on all the major audio platforms, and we've got video on YouTube if you want to watch us in action.
You can also find us on social media on LinkedIn, TikTok, and Instagram. Just search Healthcare Uprising to find us. And if you're a new company with a cool new product, if you're someone innovating alternative methods for the health and wellness space, or if you have a personal healthcare journey you'd like to share with us here at The Uprising, please email us at healthcareuprising@gmail.com, and we'll get back to you about coming on the show. Well, that's all for this dose of Healthcare Uprising. Until the next time, keep looking for the good in the world, because sometimes it's where you least expect it.
We are not doctors and we don't play one on TV. If you need medical advice, consult with your physician or a healthcare professional. This has been a Shut Up production.
Shut up!